Okay, so you've got some neck pain, and maybe it travels from the neck into the shoulder, or maybe even down the arm, and hell, it might even go all the way into the hand. Oh man, that's just a nerve, isn't it? I'm Dr. Anthony Davis, and I'm gonna show you an exercise that we do in clinic for patients, and I'm gonna show you how you can do it on your own. So let's fix this neck pain. What do you say? Okay, so in clinic, what we do is we have somebody hang off the edge of a table like this, and then we will actually move their heads for them. I'm gonna show you how you can do it on your own, but first, let me show you what we do. Okay, so we have them hanging with their head off the edge of the table. And then what we do is I hold their head for them. I provide some traction, so I'm pulling from their neck, and I provide some decompression to the neck. At that point, I keep the chin tucked, so they're not dumping their head back like this, because that's gonna hurt. So I keep the chin tucked, I provide traction, and then I provide pressure with the thumbs to press down. And then what we do, this is coming from the McKenzie therapy, MDT, McKenzie Method. So what we do is we traction, and then we press down, and then into a little bit of extension. And then we reset. And then I'm tractioning, I push down, keep that chin tucked, and moves as far back as the patient can tolerate. And we've moved this, probably spend a minute or two completing mobilizations of this area. And the point of this is to get better hydration through the discs, better movement through the spinal discs, which oftentimes, if there's a disc herniation or disc bulge, it might be irritating one of the nerves that goes into the arm, hence shooting pain into the arm. Okay, now you could do this hanging off the edge of the table and hold your own head, but that's pretty difficult. And if you're in a lot of pain, if you're in really severe neck pain, first of all, go see a physical therapist or chiropractor. Go see your doctor and make sure that they can help you out, because you're gonna definitely want a teammate in person on your side. But here's some stuff that you can do on your own if you're kind of out of the weeds, but it's still persisting, but you're not in severe debilitating pain. So we wanna grab a foam roller and we're gonna lay down. Now you can do this against a wall and you would do exactly the same stuff if you're in more pain. But if you can lay down, let's take a foam roller and we're gonna place it under the back. Now we're trying to aim kind of high up, so not down here. We're going pretty high up on the spine here. We're going in the cervical-thoracic junction. So cervical spine is your neck and the thoracic spine is your mid-back. So we're going in the junction where the shoulders meet the neck. And then we're gonna hold our own head, and I'm tractioning. I'm trying to pull my head gently, gently, gently this way while tucking my own chin. Okay, I'm holding with both hands, but I'm just showing you so you can have a better angle here. It's gonna look like this. And then I can either hold here, now I can have my butt lifted or lowered, and I can just lower my head. Again, I'm not looking up, I'm keeping my chin tucked the whole time, and I'm retracting my head to the floor. So I hold my head, I provide a little bit of traction, I keep my chin tucked. Now your elbows could be out or they could be up, and we just let the head gently lower towards the floor. Now you can just hang here and just relax. Don't go anywhere, just breathe, try to relax. Maybe this is good enough. If you want, you can also provide repetitions. So we can come up and then we can lower back down while we're tucking the chin. We can come back up and then we can slowly lower down while we tuck the chin. Another option is that we can scoot until the neck is actually resting over the foam roller, and then we just relax right here. We just chill. And this will provide some traction for the neck, so we're actually decompressing the spine. And this might feel great, it might not feel great. If it doesn't feel great, don't do it. But if it feels good, if it feels relieving, then maybe you can just chill here for a good minute or two. Now, if you are here for a minute or two, be sure to help your head when you come out of this. So I'm gonna use my hands, grab my own head, and hold it as I scoot out. And then I'm even gonna hold it as I sit up so that my head is fully supported. Because if you've been sitting there decompressing your neck for a long time, then the muscles have relaxed and you don't want them to suddenly have to support the weight of your neck. So it's good to help those muscles out so you don't come out of it and then get sort of a spasm in the neck, because then you're gonna hate me. So please take care of yourself, be gentle, be kind. As I said, if you don't have a foam roller, you could do this off the edge of a bench or off the edge of a bed, I suppose, where you just have the head hanging off. Now, getting into this position might be really painful though. If you're in a lot of pain, just getting here is gonna hurt. So you're gonna kind of hold your head as you sit down and hold your own head as you get here. So the setup is more awkward, especially if you're in a lot of pain. So I only recommend this if you're not experiencing tons of pain. Like if you can actually handle getting into this position, then we can try this, where we scoot off the edge until just the neck, the shoulders are still kind of on the bench. And then same thing, I'm providing traction for my head this way. So tractioning the head this way, keeping the chin tucked. And then what I'm trying to do is have my head do this motion repeatedly. So on lowering, but keeping the chin tucked the whole time. And this is about the pace that I would do it. So I'm gonna hold my head, and here we go. I'm lowering down, 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 and then come back up. Keeping my chin tucked the whole time. I'm just moving this arm so you can see my head better, but I would actually keep my elbows up. So here, 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 here. And then I'm gonna come back up. I'm using the help of my hands so my head can relax. But again, that last variation is kind of difficult, so please don't force it. Be gentle. I prefer the foam roller for most people. And the rolling, we're not actually rolling. We're not going back and forth. You just find a spot that feels good and stay there. Just relax and breathe, and that's all you need. If you have questions, leave them in the comments. Remember, motion is lotion, movement is medicine. I will see you in another video.